It's time now for our health report, and joining us now is Africa 54 health correspondent Linord Moudou with news of a polio milestone. Linord?
That's right, Esther. August 11 marks 2 years since the last wild polio case was detected on the African continent in Somalia, a milestone for the polio eradication program in Africa and globally. The World Health Organization removed Nigeria from the list of endemic countries in September 2015, the last African country on the list. Pakistan and Afghanistan are the last two polio-endemic countries. When the Global Polio Eradication Initiative was formed in 1988, about 350,000 children were getting infected with wild polio virus every year worldwide. The WHO says the number of infections is now down to 99%. Africa must remain a full year without new cases to be declared polio-free. Dr. Muhammad Pate is former chairman of the Nigerian Presidential Task Force on Polio Eradication and founder of the Chigari Foundation, which collaborates with the Gates Foundation. He elaborates on some possible challenges in reaching the 3-year mark and what can be done.
A couple of challenges I think that Nigeria faces. First, when you don't have as many cases as you used to, or 0 cases for 2 years, the risk is political leaders, wider society might begin to feel polio is gone and they move on to other things. We need to sustain the high levels of population immunity that led us to interrupt transmission until polio is eradicated. And it's a challenge when you don't see many cases. Secondly, there are still pockets of areas in the country which are a bit difficult to reach, previously because of security. But now that the security has improved, the program has to reach as many kids as possible in those areas to make sure that the polio virus doesn't have an area where it can continue to transmit. Thirdly, the economic circumstances in the country. The fiscal position of government is not as it used to be. So the financial position of government to fund the immunization campaigns, to fund part of the cost of vaccines, is going to be a challenge for political leaders to actually make those decisions, to apply the resources that are needed so that Nigeria remains polio-free until it's completely eradicated the virus. The current president has expressed his intent to do whatever he can to make sure that polio doesn't come back, which is reassuring. But beneath the president, there are state governors, particularly in the northeast and northwest part of the country, that need to really also remain vigilant despite the financial difficulties that they are in, to ensure that the work is done. Because otherwise it will be a disaster for the country, it will be a disaster for the continent, and it will be a disaster for the world. If all these investments that have been made over years are not allowed to get the country to where it needs to be in terms of eradicating the virus.
And medical experts have called for a renewed international effort to step up immunization and improve surveillance in the fight against polio.